Well, good morning, everyone, and thank you, Mr. Chairman, for bringing this important hearing, and of course, Ranking Member as well, and everyone on the panel for all of your work in the past and your comments about how we can plan for not just a global pandemic, but all those smaller kinds of crisis that we may have that we have to plan for, even if they're regional. And so I do believe that it's really important to keep up with research in order to understand this virus because scientists around the globe are frantically working to gain a better understanding of COVID 19, how the virus specifically attacks a patient's immune system, what treatments work, how to best prevent infection. To make sure we do not have gaps in research and information and how the virus impacts a wide range of patients, I introduced, along with Senator Rubio, the Ensuring Understanding of COVID 19 to Protect Public Health Act. This bipartisan bill would direct the NIH to conduct a longitudinal study of patients that includes diversity among gender, race, ethnicity, geography, and age, and many other things. We're looking at both its short term and long term impacts, along with interventions. This would be reported publicly on a regular basis so that all researchers and public health officials have the latest information. So, Dr. Khaldun, as a public health official directly dealing with the current pandemic, what challenges have you faced in getting comprehensive information about the latest research on COVID 19? And could you please speak to how not having robust data available hurts not only ongoing research, but patient care?
Yeah, so we all are learning about this virus. Obviously, it's a new virus, so we're all learning how it responds in the human body and who's the most impacted. But absolutely, it would be great to have more research to look at the disparities and why those disparities exist. To look at how it even impacts children. We're seeing this mysterious disease in children as well. So absolutely, the research and the data would be incredibly important to advancing this response.
So I'm building on that. What recommendations would you have for us, maybe in Congress or for others? How can we make it easier for doctors and public health officials to get this current comprehensive data? Updates are coming in rapidly. I want to avoid I really want to avoid these gaps that we seem to be having in the data between states and counties and cities, et cetera, et cetera.
Yeah, I think we need uniform surveillance and data systems across the country. We at the state, we have our own data system. The locals often are doing their own, and then we have kind of a hodgepodge of ways that we get data to the CDC, and we've recently updated that. So we absolutely need more data. It would be great to have. I would say more coordination and updating when the CDC does come out with guidance or research to make sure that our state and local governments get that as quickly as possible. So more coordination and better surveillance will be important
From the CDC.
with CDC.
Thank you. I want to move on and talk a little bit about telehealth. Of course, last week we had a great hearing on telehealth. It showed how vital this tool is for caring for patients, not only during the pandemic, but also after. So, of course, along with many of my colleagues, we support continuing the flexibilities for telehealth reimbursement that we have allowed through Medicare through the passage of the CARES Act. And I want to tell you, I think it's been fantastic. In Nevada, we have a model health company that will send paramedic or nurse to a patient's home and use telehealth to connect with the physician to treat the patient. They do a history and physical, they take the vital signs, they may do blood work right there, and then can speak with the physician. If the situation is more serious, they can get the patient to a hospital or to a follow-up, kind of an urgent care situation. So again, Dr. Khaldun, from your experience during this pandemic, how do you think that telehealth has really improved patient outcome and people's ability to receive care?
So telehealth has been incredibly important to maintaining our healthcare system during this response. And I actually hope that we don't go backwards, that we continue to use the lessons we've learned with this response as we move forward. We've expanded access in our state to telemedicine and telephonic visits, including authorization for teledentistry, OT, PT, speech therapy as well. So it's been incredibly helpful with our healthcare system. And I hope we learn from those lessons.
I hope we do too. Thank you. I appreciate you being here today.